Okay, so welcome back. We're going to now put this into action. In our last series, we talked about best practices and crisis use of PPE. We're going to put this into action with folks that are working in the same facilities that you're working in. We have two guests from the field. We have Mindy Tippins. She's a vice president for Milestone and Sunstone Healthcare, Ensign Affiliated Buildings, Utah, and a quality improvement resource that has experience in her leadership in both Washington and Utah during the COVID outbreak. And we have Jennifer Vreeland. She's a clinical resource with Milestone Healthcare and Ensign Affiliated Buildings based here in Utah and fields the kind of questions that you're asking. And we're really excited to have them share with us today. We're going to talk about the practicality of evaluating the PPE you need to use. Consider what you're going to do during the patient encounter. And just to review, are you doing minimal cares? Are you doing prolonged or close contact? Or are you doing aerosol generating procedures? If you have minimal contact, you're going to want to ensure you have good hand hygiene or gloves. You're going to use your mask and eye protection with those cases. For prolonged contact or close contact, we got to add a gown, and we're going to talk about some ways to manage that. If you're suctioning or assisting with a nebulizer, you need to have an N95 respirator at minimum, and then you're going to carefully clean all surfaces you may have touched with a disinfectant wipe as you leave. And know that we know that these are not, all of this is not always available to you at every moment, as your PPE supplies may come and go. So let's talk about some practical ways to manage this in the current situation. So we're going to talk about some scenarios with the current constraints and get some guidance from how our partners are doing this in the field. So Mindy and Jennifer, thank you again for helping me with this. Let's talk about gloves. Is there anything really important we need to know about gloves right now?
Well, I think it's really important to remember that they are not meant for a substitute for good hand hygiene. So gloves need to stay in the room, be donned when you go in the room, and stay in that room, that they're not traveling in and out. There are a few exceptions to that case, and I know Jennifer can speak to that here in just a minute, but making sure that even if you're going in and you provide any kind of cares or touch anything, it's not okay to run out and grab something from the cart or grab something from the isolation cart with your gloved hand. Please always think of an invisible barrier before you walk out of that room, and it requires doffing your glove and washing your hands for 20 seconds.
Anything to add, Jennifer?
Yeah, just when you're leaving the room with soiled garbage or linens in a bag, you can have one gloved hand holding on to that while you're going to the soiled utility room or the laundry room. Just make sure you have a clean hand that when you're opening doors and touching surfaces, that you're not using your gloves.
Excellent. So really focusing on making sure that you're using gloved hands appropriately, keeping that in the right space, and then doing that hand hygiene, which is as critical as glove use. All right, let's talk about face coverings. Let's start with goggles and glasses and face shields. How are you guys handling those with your staff?
Well, you know, there's a lot of variability on what's available out there right now, and so we've seen some pretty creative things, and how maybe one staff member is getting assigned goggles or glasses and or a face shield, and using command strips to put them in a designated area and making sure that they're cleaned. Some things that we've seen, if you've got the goggles that have holes in them, people are taping them and making sure that those are getting cleaned appropriately. So it's great to see some creative genius born out of necessity right now. But I think I'll let Jennifer speak to some of the things that she's seen in the building she's supporting.
Yeah, just ensuring that if you're taking care of a positive or potential positive, that either the staff member or assigned to the resident, and then cleaning and disinfecting in between uses. But we have seen them reused.
Okay, good. So that's a place where we can reuse things. Any comments now on masks? So either just surgical face masks, cloth masks, or N95?
So we want to make sure that everybody, I know everybody has a very conservative burn rate right now, and they're being really careful. And so we've seen some pretty ingenious practice around this, from using, you know, and as you assign a caregiver a face shield, a face mask, and N95, and then using it as long as you can, as long as it's not been degraded, and making sure that there's a storage plan for that. And again, as long as there has not been any cross-contamination. And I'll let Jennifer talk about N95s here in just a minute. But finding a space in the building that is dedicated for mask storage, and then making sure, of course, that you're never touching the mask, that you're only using the loops. And they've used things like paper bags and labeled them, command strips in a shower room. So if you have a shelf or a space, I think as long as you're creatively planning together what that looks like and making sure the staff know when it's appropriate to replace them is really important.
Great. What do you have to add, Jennifer?
Just what we've been doing is, universal masking. Anytime you come in the building in any resident areas, we're using, whether it be a surgical mask or a cloth mask designated to each staff member. When you're providing close cares to the resident, encourage them to cover their mouth, whether that be a cloth mask, a surgical mask, even tissues they could use. And then if you're working with a positive COVID or potential, that you have that N95 mask, and that we are assigning those to staff members, and they are reusing those with appropriate storing and disinfecting of those.
Okay, excellent. And I think one thing you had mentioned that I think is particularly creative, giving a cloth mask and dedicating that to a patient who has a COVID positive diagnosis and hanging that in their room, and then making that available when staff come in for cares, they use their own mask and that's reused. And so you're not burning another surgical mask for that patient each time. So
then just ensuring that we're using appropriate laundering for those cloth masks to ensure they're clean.
Perfect. Excellent. Okay. Let's talk about gowns. So gowns are a challenge given that the supply of disposable gowns is gone in some places, is really limited in other places. We're seeing increased use in cloth gowns. Any comments about how to make that work for your facilities?
I think I'll let Jennifer answer to this.
Ideally, gowns are one-time use, disposable, and discarded appropriately. We know we have a shortage of gowns, so some of the things that I've seen used is using a command hook and assigning a gown to a resident, making sure we're using gowns with any close cares for that patient. That way, if you're going into the next room, you're not wearing that same gown. They have their own dedicated gown to that resident. We understand there's a shortage of disposable. One option is maybe if we can get a hold of cloth, reusable gowns, and then laundering those maybe at least once a day, and having one assigned to each resident. And if they are requiring more than one person assist, maybe they're a two-person assist, having 2 gowns assigned on command hooks in that patient's room.
Excellent. And what I hear is just contingencies that you're trying to figure out as we go, and likely on a day-to-day basis, there may be different messages to staff about what they need to do, and being really consistent about that.
Yeah, and then just making sure appropriate donning and doffing of PPE so we're not cross-contaminating while reapplying.
Great. Okay.
I also think it's important to empower your staff to make decisions if they believe that there has been cross-contamination in any way, that they feel like they know that they can take the right steps to protect the patient and themselves. So they were providing cares or saw somebody provide cares and they were at all concerned that a patient may have coughed or had a runny nose on a gown or used in any way, that they feel empowered to make those changes immediately and get a new gown and get things going.
Appreciate that. Let's talk about laundry and garbage. We talked about, more cloth gowns being used. We talked about how to handle garbage. What are some tips you want to make sure they know?
It's interesting, things that we don't normally consider, needing to increase how often garbage is picked up at a building. And you may already be seeing a surge in that. Ironically, if we hit a surge, you're going to have to double that pickup so that we're not having anything overflow outside onto the ground that could potentially get moved around in the parking lot. So if operators and administration kind of think about those things to support the clinical staff in the building and just have those pieces ready to go, that'll be great. And then certainly laundry needs. I'm sure you're already seeing an increased need for more staffing in your laundry, and that will certainly be true in a surge. So that if you have a plan for that, when it occurs, you're good to go, and you're not running in any shortages of reusable gowns or clothing for your patients.
Great. Jen, what do you want to add? Jennifer?
Yeah, just ensuring that we're taking out the garbage, not letting it overflow in patient rooms or soiled utility. We're following our infection control practices, that laundry is ensuring they're acting like all linens are contaminated, wearing the appropriate PPE, not cross-contaminating with clean linens.
Great. Okay. And then finally, dietary. So things have changed where we're doing room service as opposed to group meals. What changes need to be considered there, and what contingencies are important to be thought of?
Back up on paper products, again, back to administrators and how they can support their direct care staff is making sure they have what they need when a surge comes. So making sure that paper products and plastic products for disposable situations for COVID positive or pending patients is really important. And then, trafficking that food back and forth and having a very strong plan around carts and trays. And I think, Jennifer, do you want to speak to that a little bit?
Yeah, just again, following our infection control practices. When a tray is going from a room onto the cart, that the cart is going down the hall, that it's going into it, that when that cart goes back to the dietary, that it's assumed it all is contaminated, that they're following infection control practices, that they're not going from dirty to clean, that their dishwasher is temping at the appropriate temperature so that it can disinfect appropriately.
All right, excellent. All right. There's a few things that I know we've talked about in preparing for this session today, and I call it don't forgets. These are things that you might not think about, and I'd like these experts to highlight them. So let's talk about these few things.
Thanks so much. I think common showers, making sure if you've got a building with common bathrooms or common showers, that you're grouping your COVID positive patients or pending positive patients towards the end of the day. Certainly that cleaning is occurring, certainly with the right product between each shower. And then if you're moving a patient from their room into a shower or into a restroom, that they're appropriately gowned and covered, which we do anyway, but certainly with a mask, keeping the mask on, making sure not to get it wet during the shower, which takes some creativity, but we can do that. And then shared equipment, like any kind of gate belts, if they're the cloth gate belts, that they need to be dedicated in the patient's room, that they're not getting trafficked in and out between different patients. If they are the vinyl ones, that they're wiped down and cleaned appropriately, and making sure you're connecting with your therapists, who are usually the gate belt gurus, that they have a plan for shared equipment while they're working with patients. Vital sign equipment, ideally, COVID positive certainly would have dedicated vital sign equipment. If that is not available to you right now, because we know that temperature and probe covers are an issue, come up with a plan for reusable, and that you're wiping down vital sign equipment in between use. Reusable medications is a big one. So anything that's going to touch the face, right? Eye drops, nose sprays, inhalers, those things ideally should not be trafficked in and out of a patient cart if they're COVID positive or pending positive right now. So we want to have a plan, make sure that the patient is safe for storage in their room, and that it's bagged, and that they're not going to use it inappropriately, or they're not confused around the medications. And then making sure that break rooms are dedicated and clean. PPE is not coming in while they're taking breaks, so that we don't do any potential cross-contamination there while we're eating and drinking in a shared space. Hopefully we continue our social distancing in that situation. Ideally, there's a place to store PPE separate from where they're going to be eating and drinking. The other thing is isolation carts, and I'm just want to make sure that everybody knows, typically people use the drawers, and making sure that there's an environmental officer that's looking in those, making sure that everything in there is clean. Stocked is a tough one right now, but making sure that those are being used appropriately. Jennifer, do you have anything to add?
I think you covered that pretty good, Mindy.
And I think something just to highlight on reusable medications, if the case would come that survey would question why medicines were kept in the room, that you described that infection control process that you have in place during these emergency times. Okay. Just want to mention keeping yourself, residents, and family safe. We want to talk about Ideally, direct care providers are going to change into their uniform at work, change out of the uniform for leaving work. If you're able to launder for them, great. If not, they take that uniform home in a bag that's either disposable or is washed, that they are taught to wash at the highest recommended temperature and dry completely in a hot dryer, and that they come ready to wear a clean uniform for each shift. That will keep their family safe and keep their uniform clean. Consider that some staff may have challenges with home laundering, and be willing to find out, what's really happening, or take that on to yourself. And then a reminder of cell phones, either not having them used during shift or requiring a process for disinfecting cell phones if they're used in the facility. I just want to thank Mindy and Jennifer for being here and talking about this today. Again, much of what they're discussing is the real world. We appreciate them sharing their experiences and hope that it has been of value to you. Thank you very much.